So we know that doing the right thing and following the rules and staying apart and following the social distancing guidelines is the right thing to do to drive the curve of infections back down. But we know that it also comes at a cost sometimes of mental health and wellbeing. That is why earlier this year, we, as part of the initial pandemic response, funded a $59.4 million package to support not just frontline services, Beyond Blue, Lifeline, Smiling Minds and a whole heap of other frontline phone, digital and community-based services. But we also funded Orygen. Orygen Youth Mental Health Services is the world's leading practice and research institute and provider for youth mental health services. And we funded them to bring on their eOrygen platform to deliver services for those young people, 16 to 24, funded that age group to deliver online supported mental health practice and support to get them through these tough times. And it's part of the $59.4 million package was $6 million to Orygen to deliver that service in partnership with Headspace and a whole range of other specialist youth mental health providers. So I'm really pleased today that in a record period of time that Orygen are now launching the MOST platform, MOST standing for Modulated Online Social Therapy Platform. It's not an app, it's a real world provision of services that meet the needs of mildly or acutely unwell young people to get the support they need in a safe and indeed sometimes quicker way than they would in any other measure. It's initially going to be rolled out in the north and western suburbs of Melbourne. It will be rolled out, and I'm pleased to say that in partnership with the mental health providers in the Flemington and North Melbourne communities will be specifically available to young people in those towers and their communities via their community mental health provider, CoHealth and other providers. And it will be there to take young people through all the supports they need, whether it be that therapy for mild or acute mental illnesses, whether it be through support for peer-based worker and other supports, whether it be for vocational support, whether it be for recovery and resilience support. All the things that Orygen and Headspace are world famous for in the real world will now be online and progressively rolled out over the rest of Victoria over coming months ahead across all availabilities for young people in those areas. We know that it's a tough time for mental health and wellbeing, particularly for young people. We know that 70% of mental health presentation conditions that occur later in life first present in this age bracket. So it is so important to get this facility and this service out in those high needs communities first and then progressively rolled out across the rest of the state. This is in addition to a whole range of the pandemic mental health responses that we are delivering, whether it be through the frontline service support to Beyond Blue, Lifeline, Suicide Prevention Line, specialist providers for perinatal and maternal mental health support, eating disorders, a whole range of specialist programs as well. We know that doing the right thing when it comes to social distancing and driving this curve down again is the right thing to do, and we will be there, particularly for young people, to make sure that we give them every assistance and every guidance to make sure they get through this and that they come back stronger and better than ever. I might leave some initial comments there, and I'm sure Professor McGorry and his team would be more than happy to answer in a lot more specific detail than I possibly could.